Hello, and welcome back to Chapter 5, Medical Terminology for the EMT. Hey, this is going to be about 21 slides, so it's a super short chapter, um, but I would strongly encourage you guys to get into the online classroom and um, look at the resources that I've put in there. There's a couple of YouTube videos in there, as well as reading your book. I can't teach you medical terminology. It's just not something that um, I can, but I guess it's not something that is like there's whole classes dedicated to medical terminology. So this is just to give you an overview of medical terminology, kind of give you that lecture type deal. So, so we're going to talk about medical terminology, um, components of medical terms. So, compounds are made up of two or more words. So, small and pox, that would be a compound word. Um, Words made from parts include roots, roots with combining form, prefixes, and suffixes. So roots are the root word, so therm, meaning heat, or cardio, heart, pulmo, heart, or lungs, I'm sorry, all of those things. And then you add it with a combining form, such as O, um, and mometer, or meter. So it now becomes thermometer. So that combining form is an O. Prefixes um, usually indicate like um, something is wrong with that body part, that uh, system. So like dyspnea is pnea is lungs or breathing. So dys is difficulty. So in this case, it's difficulty breathing. Tachypnea. So tachy is fast. Pnea is again breathing. So fast breathing. And then suffixes go at the end of the word. Um, and it's itis, which is inflammation. So arthritis would be inflammation of the joints or, yeah, inflammation of the joints. And then hemophiliac. EAC is a person with a disease. So hemo is, or hemophil is blood disorder. So basically, it's a person with some type of blood disorder. Okay, so cardiologist, this is just an example. So cardio is the root word, uh, logi is the study of, and it would be a suffix, and then ist is the one who specializes in. So actually, logi would be your, it's not a suffix necessarily, but it can be. In this case, it's a combining form. So cardiologist, ist would be your suffix. Acronyms, so these are abbreviations made up of initials that can be pronounced as a word. So CPAP uh, contains, it's a continuous positive airway pressure. Sample is another one. And it's not so much as an acronym because it's not an abbreviation. It's more of a mnemonic. So, but make sure that to use the abbreviations that are standard and accepted, and use plain language and spell out terms if you're not sure. Medical terminology is a language all in itself, and there's a lot that goes into it. But just like the English language, you may say pop, I may say soda. Um, it's just like that, okay? You use plain language to spell out terms as well. So dissecting a compound word, cholecystitis. So chole meaning bile, cyst meaning a closed sac, itis meaning inflammation. So assembled, it becomes bile sac inflammation. Cholecystitis is inflammation of the gallbladder, which stores bile. When and when not to use medical terms. So do not use when speaking to patients or family members. It goes over their head. I'm sure that in this course I will say terms that you're not sure of. If that is the case, reach out to me. Tell me, hey, what does this word mean? Ask a question. I'm absolutely okay with it because I understand that there are some times where I go over your guys' head and I speak over your guys' head. So just let me know, hey, what does that mean? How does that work? Those type of things. Occasionally, complex terms used in messages can cause confusion, even among trained healthcare professionals. Again, this is that soda versus pop thing. Regionally, they may call it one thing, we call it a different thing. So, yeah, if there's a potential for ambiguity, it's just better to use simple terms. So, anatomy and physiology. Anatomy is the study of the body structure, and physiology is the study of the body function. Okay. Anatomic terms. We went through these back in lifting and moving. High Fowlers, low Fowlers, supine, Trendelenburg, and prone. So just be aware of those things. We'll talk about them here in just a second. Directional terms. Anatomic position is when the patient is standing with facing forward, hands at sides, and palms facing forward. This anatomic position is how you will directionalize things to the patient. If it's on the patient's, it's always on the patient's left side, right side. Okay, it's always on the patient's anterior and posterior, not your anterior, posterior, not your left side, right side. It's the patient's left side, right side. Okay. Directional terms. So we divide the body into planes, slicing in the middle, which gives us our sagittal plane or median plane. And then we also we slice into two halves with a transverse or horizontal plane. Midline. So this is that imaginary medial plane or sagittal plane. So the medial is closer to the midline. Lateral is farther away from the midline. Superior is vertical or above the transverse line, and inferior is below that line. Okay, so bilateral is both sides, unilateral is one side. So if I have injuries to both of my arms, I'm going to say bilateral injuries to both arms. If I have injury to one side of one arm, I'm going to say unilateral left arm pain or injury. And then the mid-axillary line. So the mid-axillary line runs along the side of your body, in between the armpit. It splits the armpit in half and goes down the midline of your body that way. So anterior versus posterior, pretty self-explanatory. It's also called ventral for anterior and dorsal for posterior. Okay. Proximal is closer to the torso. Distal is farther away from the torso. Palmar refers to the palm of the hand, and plantar refers to the sole of the foot. Okay, so I want you to make sure that you know that when we talk about superior and inferior, we're talking about the planes of the body, and when we talk about proximal and distal, we talk about the torso. Okay, where in relation to the torso it is versus where on the plane it is. Okay, so lateral and medial, again, we're talking about the planes of the body and not the torso. Okay, torso is proximal and distal. Got it? Probably not, but that's all right. Mid-clavicular line. So this divides the chest into regions. Since there are two clavicles, there are two mid-clavicular lines. And that midclavicular line runs in the middle between the anterior axillary line and the mid-sternal line. Abdominal quadrants. So we divide the abdominal into 4 different regions. There's the right upper quadrant, the left upper quadrant, the right lower, and the left lower. And in each of these quadrants, because we can divide them up, we know what's in each of those by just looking at the abdominal and the patient telling us, hey, I've got right upper pain right up here, here. So what are we thinking? Probably gallbladder or pancreatitis. Excuse me. If they have pain in the lower left quadrant, probably some type of kidney problem. Okay. So yeah, it helps to divide the body up into these different areas. So let's talk about those positional terms. So supine is laying flat on their back. Prone is the patient lying on their abdomen, face down. And then the recovery position is that when that patient is lying on their side. It is the preferred position for any unconscious non-trauma patient. And then, of course, Fowler is the patient seated straight up with their legs dangling. Semi-Fowler is with the patient's feet up, leaning back in a semi-seated position. Okay. So again, go over your book. We're done with the lecture for this, but go over your book. Go over the resources that are in the classroom. If you have questions, don't hesitate to ask. If I throw out a word here and there, don't hesitate to ask what that is. Okay? I can't help you if you don't ask. So just ask.